Hi everyone, so we're continuing on with lecture 25. We've talked about herpes and the history of HIV. Again, there's the HIV viral particles under an electron micrograph. And so now we're going to talk about the actual infection itself and treatment for HIV. So HIV, as I've mentioned, is a virus called the human immunodeficiency virus because it's going to cause the immune system to become deficient and collapse. And the way this virus, like most viruses, works is that the virus is going to dock on your cells, specifically in this case your immune cells, specific immune cells called CD4 lymphocytes. It is then going to enter the cell, and then its genetic material is going to insert itself into your cell nucleus with your own genetic material. And it is going to cause then every time that cell reproduces itself, it's going to also reproduce the virus's genetic material along with it. So one infected cell becomes 2 infected cells, becomes 4, then 8, then 16, then 32, then 64, and so on and so on. Super sneaky, right? The other thing the virus does is then the virus's genetic material tells your cell machinery, your organelles, your Golgi apparatus, your endoplasmic reticulum, all those things you learned about in high school biology, to make more copies of the virus. So it basically turns your own cell into like a photocopy machine, and your cell starts producing virus. So infected cells will start producing new virus and then eventually get so full of it that they burst open and die and then release viral particles out into the tissues, which is primarily the bloodstream, because that's where most of our immune cells are located. So then now we have all of these thousands and thousands of other viral particles that can then infect other cells. So it has 2 ways that it kind of infects lots of cells. One is by the viral particles being released from an infected cell and therefore being free to go infect new cells. The other is that every time that cell replicates, it produces another cell that is already infected. Genius, right? It's a super tricky virus. It's very different than other viral infections that humans get. So this is that information in text, but what I want to point out that's so kind of nefarious about this virus is these T cells, these CD4 T cells that infects these lymphocytes are the very cells in our body which normally fight viruses. So this virus is essentially going behind enemy lines, infiltrating, right? It's like a mole, and it's like completely sabotaging what our normal immune response to this virus would be. So when somebody gets infected with HIV, we see 3 different stages of illness. And we're going to talk about these in turn. So acute, or sometimes called primary infection, clinical latency, which is kind of like a waiting period. Latent means it's kind of like just behind the scenes. And then AIDS itself, which stands for acquired immune deficiency syndrome. That is the disease that can be caused by this virus. So the acute infection. So I just want to kind of point out, we say natural history. That means what will happen if we don't treat it, right? On its own, what will happen? So people who get infected with HIV, more than half of them will develop some non-specific flu-like symptoms in the first few weeks after infection. So fever, malaise, which is one of my favorite words. It means just not feeling good, just feeling yucky. Some swollen lymph nodes, swollen glands, sore throat, or maybe a little bit of rash. Now, sometimes it's really severe. I had one patient who ended up getting diagnosed because he had a fever of 105 for days, as well as a severe sore throat, and that's how we caught his infection. But sometimes it just feels like you have a little bit of a cold or a flu or nothing that big or important, right? And some people don't have any symptoms at all. During this acute infection stage, the virus is replicating rapidly. So the animation that you see in the lower right is actually some bacteria that are replicating via cloning. But just to give you a visual of the fact that the virus is replicating like mad inside people during this acute infection stage. And because of that, there's they're just teeming with virus in their bloodstream, in their semen, and their vaginal secretions. So people during the acute infection phase are highly contagious. And the trick here is that the screening tests that we use for HIV, which we'll also talk about later, are antibody tests, and they will usually be negative during the acute infection phase. It can take 1 to 6 weeks for those tests to turn positive. So you can be highly infectious, test negative, right, and not know that you have HIV. After acute infection, you move into the clinical latency or the chronic phase. So usually, a couple to 3 months after the initial infection, you shift into this latent phase, which can last years, 5 to 10 years easily. At this point, the HIV antibody screening test that we do, they will be positive. We will be able to catch it at this point. People don't feel sick, however, so they don't have any symptoms. The symptoms that they had from, if they had any, from the acute illness, the acute phase resolve, they feel better. They think, oh, I must have gotten over whatever it was. And the reason why they feel better is because their immune system has responded to this infection and it has cleared up a lot of the virus. So these folks don't have any symptoms or any problems, and they are less infectious or less contagious than people in the acute phase, but they still have the virus and they are still contagious. They still can infect other people. So what's happening at this point in the body is it's kind of like an arm wrestling contest between your immune system and the virus. And there's no clear winner, right? They're each kind of keeping the other in check, right? So they're kind of locked in this epic battle. And this lasts for years. Eventually, however, in about 8 to 10 years, without treatment, so natural history, the immune system loses this arm wrestling contest and it collapses. So what this graph is showing us is 2 different things. First of all, then the blue is the number of immune cells. So we start off with a normal number of those CD4 T cell lymphocytes. The red is the number of viral particles in your body. So we can see, so time 0 is when you first get infected, and then pretty soon after that we start to see lots of virus, right? This is that acute phase of the illness, lots of virus being produced, and your immune system takes a hit, right? So these immune systems dive down, or the immune cells dive down, but your immune system activates and it's like, whoa, we've got somebody going on here. It's going to produce antibodies. And so the immune system will then rebound, it'll rally, and it'll get the virus under control. It's not going to completely get rid of it, right? But during that clinical latency phase, then it's going to be these 2 things battling each other out, right? So the immune system is in this constant conflict with the virus. Eventually, the virus wins. The virus always wins. So what happens then is you enter this 3rd phase, which is AIDS, acquired immune deficiency syndrome. As the virus starts to beat your immune system, let me clear that up so we can see a little bit more easily. The number of your immune cells falls significantly to levels that are so low that you start to feel sick because the virus starts to replicate more and more. This is a logarithmic scale over here. So this is exponential growth of the virus. And then it gets to the point where you develop these strange infections. Those are called opportunistic diseases or opportunistic infections, because your immune system now not only can't hold the HIV virus in check, but it can't fight other illnesses either. And then if left untreated, it's going to be fatal. So AIDS, this acquired immune deficiency syndrome, has 2 basic components to it. One is people develop symptoms from the virus, the viral infection itself, because now it's growing unchecked. So fatigue and malaise and weight loss, which is called AIDS wasting. So you can see in the image up above, right? He looks like he's starving. He's not. He's just got lots and lots of virus in his body, kind of taking all the resources. Also, people feel exhausted, they don't feel hungry, they're very, very ill. On top of that, you develop these opportunistic infections, these strange infections that normally our immune system can keep under check, that normally don't cause problems. So here are some examples. I'm not going to expect you to remember these, but I just want you to have heard of them. So pneumocystis pneumonia, you might remember that was one of those initial infections that made researchers go, something is going on, back in that article in the New England Journal in 1981. Tuberculosis, which can happen to anyone, but most people with treatment we can cure it and keep it under control. But in people with AIDS, they can develop really fulminant, really severe TB or tuberculosis. Toxoplasmosis is a parasitic brain infection. Kaposi's sarcoma is this unusual cancer that causes these purplish spots on the skin. And so during the kind of the peak of the AIDS epidemic, you would often see people with these lesions on their skin from AIDS. It can also cause really or predispose people to really invasive cervical cancers in female-bodied people, because your immune system is also important in protecting you from cancers as well as infections. So most people that go on to develop AIDS, where their immune system is collapsing or fully collapsed, will die within 2 to 4 years, sometimes because of the out-of-control viral infection itself, but more frequently due to those opportunistic infections, things like that, pneumocystis pneumonia, other things like that that will kill them. It is a devastating disease. So again, here's that chart kind of larger, and I just want to remind you, you have that acute infection right here, where you have the virus replicating like crazy, your immune system takes a hit, you might feel kind of sick. Then your immune system rebounds a little bit, gets the virus under control, and you move into the clinical latency period, which lasts for many years. Then after about 8 to 10 years, your immune system loses the battle, your immune system collapses, and the virus grows exponentially, causing virus-related symptoms as well as then increasing your risk for those opportunistic infections, those strange infections that your immune system also cannot protect you from. And when you enter that phase, that is AIDS, acquired immune deficiency syndrome. So what about treatment? So this is one of the most amazing things. When I first went into medical school, the hospital where I trained, which was in New York City, had 11 floors and 2 wings. And the 11 West was the HIV/AIDS floor. So we had an entire wing of our hospital for AIDS patients. Today, there is no such thing. It's really incredible. I can't even express to you how amazing the change in treatment for HIV has been. So when this epidemic first started happening and people would get diagnosed with HIV, they would often cash out their retirement savings and be like, well, okay, I'm going to die in the next 2 to 3 years, so I'm going to go to Paris, I'm going to go to Bali, I'm going to, do all these things. And then the medicines came out and they were highly effective. And then all of a sudden, people who thought they were going to die were living. And then they're like, oh, I guess I need to get my job back, right? So it was just this incredible, almost Lazarus-like moment that kind of happened. In the very beginning, when we were first discovering medications, I remember learning and training how to treat people with HIV, and it would be a regimen of about 20 different pills taken at different times of the day throughout the day. I mean, it's like 20 pills a day total, and some had to be taken with food and some had to be taken with milk, and it was really difficult and complicated. Nowadays, people with HIV, lots of folks, they just take one pill once a day, and they're really healthy, and it really controls the virus for them. It's amazing. I can't express that enough. So this is a video that the link is in the description, showing you kind of a reverse time lapse of this incredible recovery that people can make once they have access to this highly active antiretroviral treatment called HART. It's just an acronym to describe the treatments that are currently available. It's amazing to watch and to see how powerful these medicines are. So HART, or highly active antiretroviral therapy, the medications we have to treat HIV today, uses a combination of drugs to kind of block the virus in multiple ways. It prevents it from entering the cells, prevents it from inserting its RNA into the cell's DNA, prevents it from being able to replicate itself, and it's highly effective at keeping the virus suppressed and we can even now keep the viral load undetectable, which means when we test somebody's blood now and we look actually for the virus itself, not antibodies, but we look for the virus, we can't find it. We know it's still in their body, you know, kind of secreted away and hiding in some places, but we can't find it. This is amazing because it not only prevents people from developing AIDS and getting all of the things that come with that and the death that results from that, but it also means it decreases transmission from an infected mother to her fetus, as well as from one partner to another. In fact, we have really good data now that shows that if your viral load is undetectable, that means there is functionally no virus in your body fluids and you cannot infect another person. You are no longer contagious as long as you are taking the medication. Now, we know that the virus, however, is still lurking in some infected cells. We have not yet been able to fully eradicate the virus. We have not been able to cure HIV. So the treatment, which is miraculous, must be taken lifelong, right? So somebody who has HIV now, this is kind of like a chronic disease. In some ways, it's almost like having diabetes or high blood pressure, in that you have to take a medicine every single day for the rest of your life for most people. So in this country now, HIV is not usually fatal. It's just a chronic disease. You have to take a medicine regularly. You have to have conversations with your partners, unless the person doesn't know they're infected. So that's something we have to watch out, be on the lookout for, right? Or they can't access treatment. So we do have a lot of public health programs available to make treatment available and accessible to people, regardless of whether or not they have health insurance or whether it's good insurance or all those types of things. HIV treatment today is amazing. So in summary, HIV is a virus transmitted by infected fluids that come into contact then with either broken skin or the bloodstream or intact mucous membranes. For most people, this is sexual activity. It infects the immune cells, very sneaky, and there's 3 stages of infection. There's the acute phase where you may have flu-like symptoms or you may not, and you are very contagious, and tests for antibodies will often be negative in the early part of this phase. The second phase is clinical latency, that arm wrestling contest with no clear winner between your immune system and the virus. No symptoms, you feel fine, but the virus is still present and you are still infectious or contagious. Then without treatment, you will develop AIDS, or acquired immune deficiency syndrome, where the virus wins the arm wrestling contest, your immune system collapses, which makes you prone to getting strange infections, which themselves can be fatal. And the virus is replicating like crazy. It's taking over. That can cause wasting and fatigue and exhaustion and make you feel very ill. And AIDS will be fatal if not treated. Our treatments today are incredible. They're highly effective. We can often completely suppress the virus. We've not yet been able to cure it, but we can completely suppress it. We can block transmission to other people, and we can block development of AIDS, right? So people can live long, healthy lives on treatment. The treatment must be taken indefinitely or lifelong, however, because we have not fully cured or eradicated the virus from their bodies. So our final part of this lecture, coming up next, we'll be talking about epidemiology and public health as relates to HIV.